male prostitutes and act as passive agent in sodomy. Hijra are castrated before puberty. Number 2. Legal definition of abortion. Expulsion of a product of conception at any period of gestation before full term. 3. Consummation is vera copula. 4. Apta vira is a female who is capable of taking part in sexual intercourse. Non-apta vira is a female who is not capable of taking part in sexual intercourse. Aptovirus is a way by which immature girls are made fit for sexual intercourse, for example by sola pith. 5. Two-finger test is obsolete now. 6. Statutory rape means rape of a woman under 18 years of age with consent or without consent. It comes under section 375 IPC. 7. Valid consent for sexual act can be given by a female of above age of 18 years. 8. In camera trial is done in case of survivor of rape. Section 375, Section 376, Section 376A to E of IPC, and the survivor children of sexual assault case under POCSO. 9. To have sexual intercourse with a prostitute, consent is necessary. 10. Minimum punishment for rape is 10 years. Maximum punishment for rape is death. 11. Gang rape. Punishment for gang rape is section 376D, 376DA and 376DB of IPC. Minimum punishment for gang rape is 20 years. Death penalty in case of rape is under 4 IPC sections: 376A, 376AB, 376DB and 376E. 13. Death penalty in case of rape is not there under 4 IPC sections: 376B, 376C, 376D, 376DA and section 376. 14. Section 377 IPC deals with unnatural sexual offences, for example sodomy and bestiality. 15. Punishment for repeated offender of rape is under section 376E. 16. Outraging of modesty of a woman is punishable under section 354 IPC. 17. Sexual harassment is punishable under 354A IPC. 18. Voyeurism or scoptophilia is punishable under 354C IPC. 19. Stalking is punishable under section 354D IPC. 20. Medical examination of accused of rape is done under section 53A CRPC. 21. Medical examination of survivorship of rape is done under section 164A CRPC. Police or court has no power to force a woman for her examination against her will or consent. 22. Common position of hymenal tear in case of rape of a virgin female is posterior-laterally 5 o'clock and 7 o'clock in lithotomy position. Next common position is posteriorly, that is 6 o'clock. 23. In case of penetrative sexual assault with children, hymen is usually not ruptured because of 2 reasons. Hymen is deeply situated. Opening of hymen is too small to allow penis to enter. 24. Disclosure of name of survivor of rape is punishable under section 228A of IPC. Anyone who discloses it without permission of a concerned authority will be punished with 2 years. 25. Gestational sac is visible in USG at the 6th week. 26. Heartbeat is visible in USG at 10th week. 27. Fetal heart sounds can be heard between 18 and 20 weeks. 28. Jacquemus sign or Chadwick sign positive at 4th week of IUL. The color of vaginal mucous membrane changes from pink to violet and finally blue as a result of venous obstruction. 29. Catamite is a child acting as a passive agent in sodomy. 30. Conclusive test for semen is demonstration of some spermatozoa. 31. Active partner in lesbianism, tribadism is called dyke or butch. The passive partner is known as femi. 32. Pharo complex is attraction between brother and sister. 33. Greek love is sodomy. 34. Sin of Gomorrah is buccal coitus. 35. Lateral buttock traction test is used for examination of habitual passive agent of sodomy. 36. Paraphilia, in which sexual gratification is obtained by wearing clothes of opposite sex, is eonism or transvestism. 37. Paraphilia, in which sexual gratification is obtained by rubbing against any person in a crowded place, is called frotteurism. 38. Irresistible excessive sexual desire in a male is known as satyriasis, and in female It is known as nymphomania. 39. Exhibitionism is punishable under section 294, punishment 3 months. 40. Bobbitt's syndrome is cutting of penis. 41. Paraphilia, also with obscene telephone calls, is known as catalogia. 42. Dippoldism, sexual gratification by abusing, that is beating or whipping children. It is sadism. 43. Lendrum stain is used for amniotic fluid embolism. 44. Lugol's iodine is applied on the glans penis of an alleged suspect or accused of rape. It turns to if brown color develops. Arrow, it suggests that he committed rape. How? Actually, Lugol's iodine reacts with the glycogen present in vaginal epithelial cells, which gets deposited on penis during sexual intercourse. This test is positive up to 4 days of sexual intercourse. 45. Florence test is used for detection of choline in semen secreted from seminal vesicles. 46. Barberio's test is used for detection of spermine in semen secreted from prostate. Picric acid is used here. 47. Acid phosphatase present in highest concentration in seminal fluid. Acid phosphatase test or Walker test is one confirmatory test for presence of seminal stain in case of a person suffering from azoospermia. 2. Best test for detection of the seminal stain in old stain. 48. Vaginal swab of a survivor of rape demonstrates spermatozoa if vaginal swab is taken within 72 hours after assault, but vaginal swab can be taken within 96 hours to demonstrate semen. Multiple choice questions. A 16-year, 4-month-old boy commits rape and to hide evidence he kills and buries the body of the victim. Which one is true among the following? He will be sent to jail for more than 7 years. That is true. Life, death are not true. Reformatory center also not true. A man had sexual intercourse with a woman. In the court, woman told that she did not consent. Here the court shall presume that she did not consent as per section 114A of Indian Evidence Act. A private hospital denies giving first aid treatment free of cost to survivor of rape. The hospital in charge or the doctor may be punished under section 166B for 1 year imprisonment. A doctor disclosed the name of a survivor of rape to news channel. He may be punished under 228A of IPC. A private hospital denies giving first aid treatment free of cost to a survivor of rape. The hospital in charge or a doctor may be punished under 166B of IPC. A pregnant woman has been awarded capital punishment. High Court shall order the execution of the sentence to be postponed and may it thinks fit commute the capital sentence to imprisonment for life according to 416 CRPC. A radiologist disclosed the sex of baby to the mother. Doctor may be punished for the first offence for 3 years imprisonment. MTB Amendment Act 2021 has allowed medical termination of pregnancy up to 24 weeks of pregnancy. A single doctor can perform MTB up to 20 weeks of pregnancy. If a police officer denies to record FIR of a survivor of rape as per 166A of IPC, he may be punished with imprisonment of 6 months to 2 years. Rape has been defined under 375 IPC. Outrage of modesty is punishable under section 354 IPC. Sexual harassment is punishable under section 354A IPC. Stalking is punishable under section 454D IPC. Statutory rape is rape of a girl under 18 years. Valid consent for sexual consent can be given by a female above age of 18 years. Regarding rape, which one is incorrect? Examination of victim of rape by doctor is done under 53A CRPC is incorrect. What are correct then? A child of 16 years of age who committed rape will be sent to jail is correct. Age of consent for sexual intercourse is 18 years is correct. An impotent person can commit rape is also correct. Death penalty is given under 376A IPC. Punishment of a repeat offender of rape is given under 376E IPC. Death sentence in rape is given under 376A IPC. For sexual intercourse with a prostitute, consent is necessary. Concealment of birth by secret disposal is punishable under 316 IPC. Section 377 IPC deals with bestiality. Unnatural sexual acts are punishable under 377 IPC. Greek love is sodomy. Lateral buttock traction test is used for examination of passive agent of sodomy. Sin of Gomorrah is buccal coitus. Paraphilia, in which sexual gratification is obtained by rubbing against any person in a crowd, is frotturism. For how many days? Lugol's iodine test for detection of vaginal cells on the penis is positive in case of rape, 4 days. The type of paraphilia where gratification is obtained by wearing clothes of opposite sex is transvesticism. Which of the paraphilia is punishable? Nymphomaniac. Masochism is punishable. Exhibitionism is also punishable. A man secretly watches the private activity, bathing of a woman through a hole in the wall. He is punished under 354C IPC. All are probable signs of pregnancy except Leyden's sign is softening in the middle of uterus anteriorly at the junction of uterus and cervix at 6th week. Gang rape of a woman of less than 16 years of age comes under 376 DA IPC. Gang rape of a woman less than 12 years of age comes under 376 DB IPC. Stalking is punishable under 354 D IPC. Order in Lochia is Rubra serosa alba. Bluish discoloration of vagina is seen in pregnancy is known as test name. Cohabitation caused by man deceitfully inducing belief of a lawful marriage is punishable under 493 IPC. Husband is punished for intercourse with wife during separation without her consent in 376B IPC. Toluidine blue is used to examine fresh microabrasions. Intercourse with closely related individual blood is known as incest. Infertility can be diagnosed where a female is not conceiving after 1 year of unprotected intercourse. Fetishism is a paraphilia characterized by sexual pleasure from inanimate objects. According to POCSO Act, the definition of penetration sexual assault, penetrative sexual assault starts with the person is said to commit. According to 375 IPC, definition of rape starts with a person is said to commit. If a person is impotent towards a particular woman but not towards others, the situation is called impotence qua ad hoc. Impotence qua ad hoc. Cardiac activity in a fetus can be made out by 6th week. Transvaginal USG can detect fetal cardiac activity in 7 weeks. Which IPC section is about feticide as well as infanticide? 315 IPC. As per Artificial Reproductive Technology Act, an oocyte donor can donate oocytes 59 only once in her entire life. As per Surrogacy Regulation Act, the eligibility criteria for the surrogate mother are all except age must be more than 18 years. She must be close relative of the couple. She should be married. She should not act as a surrogate mother more than once in her lifetime. 61. Eligibility criteria for intending couple are all except is may be married, unmarried, except that intending couple. They must be Indian. Man 26 to 55, woman 23 to 50, should not have surviving child, either biological or adoption or surrogacy. 62. Legal status of surrogacy in India. Both gestational surrogacy is legal, altruistic surrogacy is also legal. Commercial surrogacy is not legal. Regarding two-finger test in examination of a survivor of a rape, both unscientific methods of examination and has no forensic value, obsolete now. 2 RMPs are required to terminate pregnancy after 20th week up to 24th week in all except woman victim of vitriolage. 2 RMPs are required except woman victim of vitriolage, survivors of rape, pregnant unmarried woman, paralytic woman. All these things you need.